Hi everyone, I'm Dr. Justin Lin here at Rehab Revive Physical Therapy, where we rehab your mind to revive your body. Today I want to talk about the number one stretch exercise, range of motion exercise that we give to those of you who have had total knee replacements, as well as meniscal repairs, ACL reconstructions, or any type of knee surgery that has restricted range. We want to be able to get you back to walking and more range as soon as possible, so stay tuned. So before we get into this exercise, I'd like to share a personal story about my ACL reconstruction journey. And largely is that I woke up and my knee was inside the CPM, this constant passive range of motion machine where I was trying to work on bending. It's a common thought that bending is the most important thing. So we always want to keep trying to bend our knee, especially after a knee surgery. But it's not true.
It's a lie!
It's gonna be extending your knee or straightening it out. And I like to give this story where, I was really freaked out to just even hobble to the bathroom. And if my knee could bend all the way, it would be great. But what happens is when I put my leg down, I have nothing stable to be on, and then I'd collapse. Ripping my knee back open again and going through a second surgery is the worst thing ever. Knee surgery, ACL and knee replacements rated the top two most painful orthopedic surgeries subjectively of all time. So doing that again, is that smart? Probably not. But I think some of you who have had the surgery or who are recovering from the surgery can relate. You just want to be able to do certain things and be able to be stable on that knee. So straightening out is going to be the goal. So stay tuned. We've got this great exercise coming up. So everyone, I'm repping my Boston University BU socks. What we want to do is we want to put pressure through your heel, but how you want to align yourself first. You want to slide it just slightly off the table or off a surface like your bed. And what most people, when they're they're in the very beginning after surgery, their legs aren't very straight, so it's going to look something more like this. What you're wanting to do is you're going to use your other foot, you're going to push it, and you're going to try to stretch it. And you're going to go to the point where it feels pretty uncomfortable, almost slightly scary. That's probably the best way I can describe it. When I was doing it for myself, I thought I might break off my leg, but not to that point, but just right before it is probably the best way, the right amount of pressure. So you're going to press into it, and what I'm going to do is I'm going to have two forces. One's going to go this way, one's going to go this way. I'm going to push into it, then I'm going to let it relax. And then, so over time, I'm going to push into it, let it relax, push into it, let it relax, push into it, let it relax, push into it. And of course, my range is pretty good right now. No surgery left over or no lack of range in this knee. So we want to hold that. And you're going to do this till the best way to go how far is too far is that you check your other leg and you're like, okay, this is usually pretty soft. There's still a little bit of resistance left. So once you get to close to like less than 5 degrees left, it does feel straight, but you're just not that perfect springiness like my other side. So you want to work into it, and then you back off, work into it, back off. You do this for a couple minutes, then you get up and try to get it bending and straightening again, and you keep at it over time. Hopefully you gave this exercise and stretch a shot. I know in the very beginning, it can seem very scary. You're welcome to check with your healthcare professional if this is the best exercise for you. However, like I said, getting it to straight, getting it to zero is probably the number one key to getting you better functionally, faster, and back on your feet. So that's gonna be the goal. Like I said in the video, that you wanna really focus on just getting that stretch and trying to get that equal. If you feel a little bit of pain and you need a little bit of break, give yourself some grace, give yourself a little break. You don't have to force this all in one day. It's gonna take a little bit of time, but this is gonna be the essential goal to being back on your legs, walking, and then doing all the things that you wanna do. So yeah, if you give this exercise a shot, we'd love to hear your feedback. Please leave that below. If you know anyone who needs this, please share this and subscribe to our channel. We thank you for all your support through the years, and we're excited to keep giving out the best information to everyone out there. And of course, if you liked it, leave us one of these. I'm Dr. Lin. Remember, we heal smarter, not harder.